welcome. You're watching Medically Speaking, and I am Minakshi Upreti. Joining me right now is the Senior Director of Neurology at Max Parparganj, Dr. Vivek Kumar. Thank you, sir, for joining us on NewsX. My very first question: all of us, and I'm sure as you know, are almost done with COVID. We have thrown caution away. Many people are mingling openly. End of the day, how long can you stay locked up? But long COVID, that's something which nobody is talking about, and the risk of neurological disorders. First of all, can you explain a little more really to our viewers on that front?
Basically, SARS-CoV-2 is a virus which has a lot of neurotropic and neurovirulent effect, and it can cross the blood-brain barrier both hematologically as well as through the our olfactory nerve. And it has both acute manifestations as well as long-term or long COVID manifestations, as you were mentioned very rightly. And so what we see that people have become ignorant about the fact that this virus can have a long-term effects as well. And these long-term effects can affect the person's performance by producing various psychiatric manifestations as well as neurological manifestations.
Yes.
So because of the neurotropic effect, the acute manifestation, the most common was the loss of smell and taste. That is anosmia and ageusia, which was widely seen in our Delta variant time. And headache and dizziness was also very commonly seen. Then we also used to see a lot of acute mental status abnormalities, mental confusion, mood disorders, encephalopathies, brain stroke, both hemorrhagic brain stroke as well as ischemic brain stroke. Seizures were common. Then there was a disease of neuropathy known as GB syndrome or Guillain-Barré syndrome, in which the body's nerves become weak and affect the patient's ability to move around. He may become bedbound also. Now, coming to the long-term effects can consist of cognitive impairment, confusional state, recent memory, effect of attention deficits, lot of anxiety manifestations, depression, sleep disturbances, inability to concentrate, lethargy, lack of energy. So, a lot of psychiatric manifestations have been reported by patients of SARS-CoV-2 when they have recovered from their primary viral illness. These symptoms have become a cause of concern.
Right. And so there's a latest study, I'm sure you know about it. You have, of course, spoken about the neurological disorders which many patients who were impacted with COVID face, and of course, the long term neurological issues. But a new study now says that catching COVID increases the risk, as you were also pointing out, of neurological and psychiatric disorders. And that seemed much more prevalent in adults than children. Can you elaborate on that report also a little bit, and also help the viewers understand how worried should we be?
See, there was a recent study reported from Lancet, and which has shown that people who have suffered COVID infection or a SARS-CoV-2 infection have been reporting a lot of behavioral problems and a lot of cognitive impairment in terms of recent memory loss, in terms of poor executive functional capacity, in terms of poor attention. A lot of them say that remain confused. There is a loss of memory, which is very common, and there is a what was commonly termed as a mental fogging or
Yeah.
mental clouding of mentation. So that was very commonly reported, and because of the long-term effects of this virus, we have been seeing a lot many patients who come to us with memory disorder, loss of attention, loss of ability to carry out their normal activities which they were doing earlier
Yeah.
as normal as anyone else. Then there are a lot of psychiatric manifestations that have been reported, and they have been reported in even those who have had this SARS-CoV-2 infection in 2020. That is 2 years from now, and these include a lot of sleep disturbances, a lot of anxiety and panic disorder, a lot of mood disorders, and inability to cope up with the stress. And of course, there has been trigger points, loss of a family member, loss of near and dear ones, which
Yes.
have been the cause of anxiety. But even otherwise, there has been a lot of complaints
Yeah.
of sleep disturbance. the memory disturbance, anxiety that we have been seeing in patients who have recovered, but they still face all these problems. That
Yes.
post-traumatic stress disorder is another very common problem.
Yes, and it's you've stretched and touched upon the post-traumatic stress disorder. Of course, that's something which many unfortunately are facing because of the losses we'd all seen during COVID. But sir, speaking specifically of those who are in the recovery phase or who perhaps have completely recovered from COVID, what are the symptoms would you suggest today they need to look out for, sir?
We should look for the symptoms of sleep disturbance, the symptoms of restlessness, irritability, uh, lack of energy, the mood disturbances, confusional states, patient not able to do his normal professional activities, keeps himself isolated, social isolation, all these things should be addressed. They should come forward, report to the doctor, neurologists and psychiatrists are there to help. They may need counseling. So the important thing is that they should report all these things to the doctor. Most of the time, what we see that they are not coming to
Yes.
the medical personnel for help.
But sir,
They are not
I'm
reporting.
sorry I'm interrupting you here, but a lot of people, I believe, also may not come for help because the symptoms, till of course you have a very clear memory loss, they seem to be rather generic. One may sort of misunderstand and confuse these symptoms because they're happening months after their recovery from COVID. So how do you suggest, for the layman watching the show that they catch these symptoms and reach perhaps experts like yourself, sir?
See, suppose they are in their job or they are in their normal activities, they are going to the market. If they are not able to remember the small things, the recent events, the recent memories is the first to get affected, and they are mainly because of the loss of attention, not because of any memory disorder or any dementia, but mainly because of decreased attention because of the suffering from COVID and associated anxiety and depression affects the ability to perform optimally because of decreased attention level. So decreased attention will cause you unable to focus. You will not be able to sleep adequately. You will not be able to perform your day-to-day routine activities. If you are
Yeah.
not able to perform, you are always complaining of ghabrahat, irritability, lack of sleep, lack of energy. So all these symptoms are simple symptoms, but they should be reported and help is there. You can take the help of a neurologist, you can take the help of a psychiatrist, you can take counseling sessions. So, but you need to understand, be aware of these symptoms and report them to the doctor.
Mm. And if someone does report to, say, experts like yourself, sir, what's the course of action that you take from there? What is the recovery period? What's the treatment which these people, those who are suffering from at least brain fog, and memory loss, could be looking at, sir?
See, most important thing is to reassure them that there's nothing very serious. This can be dealt with adequately. There are ways to deal with it, both medically as well as by counseling. And so even those who have memory issues, those who have attention deficit, they can undergo proper neuropsychological evaluation to see is there any other reason besides COVID as a cause of these symptoms. And if there are no other reasons, that should again reassure the person that these symptoms can be properly dealt with. And of course, it is a multi-disciplinary approach involving a neurologist, a psychologist, and a psychiatrist,
Hmm.
and probably a physician who can together evaluate such patient and see what help can be offered.
Right. And sir, my last question before we let you go, as you sign off, what is the one advice you'd like to give people who are watching the show today, sir?
Don't take COVID lightly.
Yeah.
Continue your COVID appropriate behavior because that is more important. Because even though we are saying less number of patients, less severe COVID, the Omicron variant is less severe, but we still need to be cautious. We still need to have COVID appropriate behavior as a most important safeguard. Or, of course, vaccinate yourself. And if you are not vaccinated, then if you have any of these symptoms, lack of sleep, confusional state, mental fog,
Yes.
inability to recall events, inability to perform optimally professionally, or any personal problems, you must report them to your doctor,
Hmm.
either a neurologist or a psychologist, discuss with him and say what help can be done. And it most
Yes.
of the time people do improve over a period of time. All these symptoms can be dealt with adequately. So reassurance, I would like to reassure people that don't panic. There is no need to be depressed. There is no need to be anxious about if you have any of these symptoms, they can be adequately addressed.
Yes, absolutely, sir. Very succinctly said in a simplified manner, of course. I hope the message has reached out to the audiences watching the show. End of the day, treatment possible, available, but as of now, at least follow COVID protocol. Caution, always better than cure. For now, Dr. Kumar, thank you for joining us on NewsX.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.